real quick, okay? Because this is gonna be in the slide that's coming up. And when we get to that slide, just skip through it. We're gonna be incorporating a new program that's gonna be through the intranet, through your company intranet, that everyone has to take a look at. Okay, it's gonna be mandatory, I hope. Okay, and we're gonna I'm gonna be putting that together next Wednesday with the company called Jellyvision. And it's kind of a cool little deal if you haven't heard of it before. What it is, it's an interactive program that once you click on the link, you look at it and it says, "Hi Terry, how are you today?" And then Terry says, "I'm good." And it says, "Terry, how many times did you go to the doctor last year?" And she says, "I went 17 times because I sit in this chair." And they say, "Okay, fine. How many medications do you take annually? Do you think?" It's kind of stick figures and little egg figures, and it's kind of funny. And they'll take all the information you give them, then they'll open up the plan designs that we have decided on, the 3 plans, and they'll recommend which plan you should be in, depending on your situation. And they'll explain to you why. And they'll show you all the benefits, and they'll answer any of the questions you have, and it's all interactive. And they'll touch on the FSA. And they'll also have incorporated into the slides, into the presentation, into the program, the cost to you and for each plan and how it's going to affect you going forward. So it's a pretty neat little thing. And as I told Terry, then we're going to provide that for you, and it's going to start probably, I was trying to guess what day would be best to say, because I don't want to be wrong. Sometime first week of November, it'll be ready to be distributed to the employees. So that gives you time to look at it, think about it, and then when open enrollment comes the first week of December, you'll have an opportunity to make a choice. It gives you an idea to make valid, wise choices on your benefits going forward. All right? So that's your Jellyvision. Guardian staying the same. Now what we're going to do is have Mary Ann talk to us about the changes we have made in the 3 programs.
Okay. So there'll be 3 programs. All 3 are EPOs, which are in-network benefits only, and that's currently what you have right now. So you're going to want to make sure that you definitely use doctors that are in the Blue Cross Blue Shield network. The network's worldwide, so you're going to have a great selection of providers that you can choose from. And the premium plan, the deductible will go up to $500, $1,500, and then the middle plan is $1,500, $4,500, and then the new plan that's been added has a $2,500 deductible, $5,000 per family. After the deductible is met, all services on all 3 plans are going to be paid at 100%. Now, not all your services are going to be subject to that deductible. You're still going to have your co-pays if you just go to visit your primary care physician. That'll be $25 for the PCP, $50 for a specialist, and then $30, $40, and $25.50 on the 3rd plan. Okay. There he is. So,
You're on, Big Dog. If Mary Ann, if you want to take over?
I don't want to disturb you, but
it's fine, whatever you want to do.
go ahead.
All right. Don't grade me or anything. Okay, so, anyway, so your PCP and your specialist visits will be the $25.50. Urgent care is going to be $50, $40 for the middle tier, and then $50 for the 3rd tier. Emergency room is going up to $200 copay for each of the plans.
Excuse me, Mary Ann. This
That's
stuff's
all
all
right.
in there. You can follow along in the first
Right, if you
slide.
wanna follow.
On
Well,
the
we're not gonna
left-hand
go
side.
through everything all, you can read these yourself. So the deductible is mainly your high ticket items, like your hospitalization, surgery, that sort of thing. You will be getting new ID cards regardless of which plan you choose to go into, because the emergency room copay is on the ID card. So round about the end of December, hopefully you'll get your new ID card so that you can use for January 1. Any questions so far? Okay. Everybody understands the changes? Okay.
Yeah, I get this. In your package, you'll see that this now is what our payroll deductions are going to be on the plan choices that you make. And I don't think these are in our packets, are they, Drew?
No, we don't.
We don't do that, okay, okay. So as you can see, which I can't because I already put my glasses on. As you can see, right up here, and this, I understand from Marina that this slide has been, this whole presentation has been made available to you on the internet, correct?
Correct.
So you can go on the internet and look at this stuff a little more closely, develop any questions, give us a holler, okay? You can see if you go with the, what we consider to be the rich plan, the buyout plan, that's the $500 deductible plan 100%. If you do that out of your pay, it would be $93.98 per pay. If you just, we're just gonna talk single at the moment. You can see where the parent, husband and wife and family comes in at. The $1,500 to $4,500 plan at 100%, that plan's the one that we placed $1,000, $3,000 that we had before. That moved up to a $1,500 deductible. Everything else in the plan is the same, except for the emergency room copay. That went from $100 to $200. Okay, and I'll tell you why in a second. But if you decide on the $1,500, $4,500, which is probably the most popular plan that we had before, the $1,000, $3,000, because it was the lowest plan we offered, it's $65.18. However, we've added a new plan that's $2,500 deductible, 100%. On that plan, as you can see, the single is only $41.34 a pay, coming out of your pay, and that's a good plan. If you're single, young and healthy, that ain't a bad deal, all right? Because the only thing that's going to affect is going in the hospital, home health care, medical crutches and stuff, things like that, outpatient surgery, or for your co-pays, for your prescription drugs, everything's going to stay the same.
Excuse me,
Ma'am.
since I was letting Drew in, can you tell me what the deductible thing with the
Sure.
500, 1,500?
Sure. Go back and
Yeah, the $500 deductible right here is the rich plan, we call that, okay?
Okay,
It's $500, 100%, and it has a $25 copay for primary care, $50 copay for urgent and
Okay.
specialty care. Emergency room, as I mentioned, is 200%. It's $200, and the prescription drug card stayed the same at $20.60.80. Lab is $25, imaging is $100, and $35 for the standard imaging. That's like an X-ray or something.
I do have a question. Is
Sure.
the copay before or after the deductible?
Copay's always.
Yeah.
Before?
Yes,
and then it caps out at 1,500, is that what you're saying the 1,500 is?
No, the copays are always going to be there. What caps out after the $500 or the $1,500 is like hospitalization, durable medical equipment, home health care, things of that nature, outpatient surgery.
Right,
Not everything is affected by the deductible, just like it wasn't before.
right.
It was the same deal, only it was $1,000 deductible instead of $1,500.
So
So
the copays are always in effect?
until you
Whether
hit your,
Whether you hit the deductible or not?
absolutely. Yeah, you're always gonna pay your copays.
And do they count toward the deductible?
No, they count towards your total OOP, out of maximum, out of maximum, big.
Out of
7,100.
pocket, yeah.
Out of pocket maximum. It applies towards that. And we always say that if you have an out of pocket maximum of $7,150, right, $7,150, right? Your out of pocket maximum is $7,150, and what goes towards that is your $1,500 deductible, if you're looking at that. What goes towards that is your $20 copay, your prescription drug costs, your emergency care, whatever you have done, copays goes towards that $7,150. So if you hit $7,150 in a year, you don't pay copays anymore. But you probably ain't a lot, because you use an awful lot of copays towards that $7,150.
And the premium does not count toward the total out of pocket?
No, absolutely not.
Well,
No.
we're gonna get to another slide here.
Yeah, which explains
Show
it. Yeah.
the total annualized premium per plan and the total maximum out of pocket.
Right, and we'll show that. But those are the three deductibles we've decided upon, the $500, the $1,500, and the $2,500. The one that makes most sense for a lot of folks is gonna be the $2,500. Because unless you're having surgery, you're gonna be saving, well, we'll show you the slide. You'll see the slide that comes up in a little bit. And those are the rates that are gonna come out of your pocket, out of your pay. $65, $93 for the $500 deductible plan, $65 for the $1,500, and $41.34 for the $2,500 deductible. Those are the numbers that will come out of your payroll, as opposed to what's coming out now. And if you have a parent, or, excuse me, if you have a child or a husband or wife on there, you see the rates that are gonna be coming out of your pay. These are figured up on your 26-week pay basis, okay? 26 pays. Any questions on that? Now, once again, I know we don't have a slide for you for that, but we really can't give that to you because that's between you and them. All right, so go on the internet, you can find that slide. Okay, and you can figure out which plan makes more sense to you. Okay, this is just a comparison of what the single number is gonna cost you on an annual basis, right, Drew?
Now, what this slide.
What is that slide?
The actual total cost of the plan.
Oh, the actual total cost before they get deductions.
So if you take a look at the, using the $2,500 deductible plan as an example, $41 and change is coming out of your paycheck. You guys have 26 pays per year, per year. So say roughly $85 to $87 a month is what your pay is. The rest of that $592.49 is coming out of Westside Health's pocket to pay for your health care. So it is very generous what they are giving towards your health care to help you with your, pay your premium.
Okay, next slide.
So.
This is you, because you did this slide for
Hi,
us.
I'm Drew with Highmark. I'm the client manager. I wasn't supposed to be here today because I had meetings down in Dover, but they wrapped early, so I zipped up here to try and help out. So what this slide is basically a cost comparison. If you look at everything all in, your premium, which is the amount that's taken out of your paycheck, versus what your total exposure would be amongst all three plans. So what we did is we took the annual per pay deduction and we annualized it. So if you went into the EPO 100 500 plan, and these calculations are based off of employee-only coverage, all right? So you're just covering yourself under that EPO 100 plan with a $500 deductible. Before anything is covered, right? It's $2,443.48 out of your paycheck per year for that coverage. You have the $500 deductible on that plan for services like hospitalization, home health care, durable medical equipment, okay? You have copay costs. I'm not sure how many copays you're gonna incur over the year, so we kept that as unknown. But your terminal liability or your cap in that plan is $7,150. That's the total maximum out-of-pocket that's mandated by the Affordable Care Act. It says no matter what your deductible is, no matter what your copays are, the maximum that you're gonna pay for copays, deductibles, etc. combined is gonna be $7,150. And you'll see that that number is consistent amongst all three plans, okay? So what I did is I took your total exposure from a payroll deduction standpoint and I added that to the $7,150. So if you had a terrible year where you maxed out your total maximum out of pocket, when you add that to the premium, you're looking at a total exposure of $9,593.48. Okay? Now you're not gonna hit the $7,150. All right, you probably will hit the $500 deductible because that's low and most people will have some sort of service that's gonna cut into that deductible. Okay, and you'll have some copays. But really, what you really want to concern yourselves with is the first row, which is the amount taken out of your paycheck on an annualized basis. Going down to the next plan, which is the EPO 100 1500, the annual amount out of your paycheck just to cover yourself, it's going to cost you $1,694.68. Have a terrible year, add that to the $7,150, it's an $8,844.68 exposure. And then the base plan now is $1,074.84. That's what it's gonna cost you per year to have that plan. And then with the total maximum out of pocket, it's total exposure of $8,224.84. It sounds like $2,500 is a lot, a big hurdle to overcome if you're faced with healthcare costs, but there's a couple things that you want to take into consideration when making a decision on your plan. I like the base plan, and the base plan is very popular amongst a lot. I work with about 70 different employers in the state, and where we're seeing a lot of employers offer benefits, $2,500 is really the starting point now, okay? And when you take into consideration with that $2,500 deductible plan that all your core benefits are going to be subject to copays, which is outside of the deductible, things like your office visits, things like emergency care, things like labs, x-rays, and your therapies like physical therapy, occupational therapy, and speech therapy, and your prescriptions, all subject to copays. You don't cut into that $2,500 deductible, okay? If you do need to go into using the deductible, we do get good discounts on our doctors and our network surgeons charges, okay? We have renegotiated our contracts with the hospitals now, where we pay for outcome, we pay for value, as opposed to pay as you go. So just because you're faced with a $2,500 deductible and you're going in for surgery, doesn't necessarily mean that $2,500 is going to come out of your pocket. I'll give you an example. I had surgery years ago on, I had oral surgery. And if I didn't have health insurance, it would have cost me $4,000 for that surgical procedure. But because we hold a contract with the doctor that did the surgery, in his contract with us, we negotiated it down to $440, I think was the total amount for his cost. So, I mean, it sounds scary to be faced with a $2,500 threshold, but you have Blue Cross working for you to work on discounts with our provider family, our provider community. Okay?
And just one thing, just keep in mind, so we don't get confused on that. That $2,500 is hospitalization, outpatient surgery, durable medical equipment, and therapies. This is not like going to your doctor, getting your medications. This is not like getting an X-ray or an MRI. There's co-pays for all of that. Okay, this $2,500 is going to affect you getting to the hospital.
The other thing that I just want to draw your attention to, if you look at the $2,500 deductible plan versus the $500 deductible plan, there's about a $1,500 difference in what's coming out of your pay. You've got the $500 deductible on that plan that you're already going to pay almost $1,500 more. So there's $2,000 right there.
You're not really saving anything.
Right.
Next slide.
Okay. So, Mary, do you want me to continue or? All right, I'll go ahead. So, a couple things that you want to take away from this meeting is we want to be prudent healthcare consumers. So, you know, when you have a situation where you need emergency care, and it's one of those situations where you can stop and make a decision, do I want to go to the hospital or do I want to go to urgent care? If you can take a minute and make that decision, chances are you want to go to urgent care. So, with urgent care facilities, they will provide you with a lower cost. Your copay for urgent care will be your specialist copay versus the $200 at the ER. So you're going to save money right there off the bat. Plus, it's going to take less time for you to get in to see a doctor at an urgent care facility, get treated and released, than if you went to the emergency room for a simple emergency. What's going to happen at the emergency room? My mother just went for pneumonia. She was in, they called her back, they took her vitals, and then they stuck her in a gurney in the hallway for 14 hours before they went back and treated her and released her and sent her home with like Tamiflu or something, right? So if you got a situation like that, I used it for, I had pneumonia and I went to Silverside Medical Aid Unit. I got in, diagnosed, and given a prescription and was sent on my way in an hour and a half on Saturday afternoon. And I went back and I laid in bed and I was miserable. But I was uncomfortable instead of sitting in the hallway in a gurney. So be mindful and use the lower cost alternative. It's going to save you time, and all of these doctors and these urgent care facilities are in our network, so they go through the same credentialing process based on quality and cleanliness of the facility and everything, just like the hospitals do. Okay? And then another thing that we have that's available for you, which is another cost alternative and a convenience, is telemedicine. This is a new benefit that was dropped into your benefits on January 1st of 2016. And it was mandated by state regulation that we provide this benefit. And think of telemedicine as the iTunes of healthcare delivery. So instead of going into a record store and buying a CD, okay, now most people get their content digitally. They can either do Google Play or they do iTunes, right? This works the same way. What you're going to do is you're going to interface with doctors to treat you for simple conditions through your phone or your tablet. The copay is $5 less than PCP. Again, it's accessible through your smartphone or your tablet, and you interact with the doctor through FaceTime if you're on an Apple device, or Skype if you're on something like Android or Windows phone or BlackBerry or some other type of platform. And then the other nice thing about telemedicine is the doctor has the ability to pharmacy. My doctor, if I know what's going on with me, I'm prone to sinus infections twice a year, so I know what's going on, I know what the situation's gonna be. I can't call my doctor and say, hey, I'm on the way to a sinus infection, can you call me in a prescription? He's gonna want me to get in my car, go and see him, and then he's gonna give me a paper prescription. The nice thing about this is, you're interfacing with the doctor in the convenience of your own home through your smartphone or through your tablet, and then they're calling the prescription in your pharmacy. So really, all you have to do is go to the pharmacy and get your prescription once you're done. So if you want to go into the next slide, talk a little bit more about medical aid units and what they're available for.
Yeah, excuse me.
Yep.
Just recently, I sent to Terry this exact brochure here, this medical aid unit deal, with a list of all the medical aid units throughout the state. And explained in that little blurb that I sent out to you that it's cheaper to go to the urgent care than it is the ER. And everybody got that through the internet, right? Sarah?
Yep. It was an
Email.
email.
We all got it through the email. So you should have an explanation, a full explanation of the stuff, but Drew's just gonna touch on it briefly.
So medical aid units are available to treat you for minor lacerations, you might need a stitch or two, sprains, headaches, fevers and flu, pneumonia, allergies, coughs and colds. They're a really good resource during flu season when you can't get in to see your primary. You can go to an urgent care facility and they'll be able to treat you there for like a flu or whatever. But nobody's gonna get the flu because everybody's gonna get the flu shot, right?
Already
Okay,
did.
good. So medical aid units are open evenings, weekends, and major holidays, right? Next two slides talk about virtual medicine and how you would use it. So the first thing that you're going to want to do in order to use virtual medicine is you're going to visit our website. There is a link to setting up your profile. It's just like when you would set up your profile first time for Amazon, where you get your name, your address. It's going to ask for your age, your sex, your ID number, I believe, and then it's going to ask you to fill out a medical questionnaire based off of your condition that you're seeking treatment for. And then once you set up that profile is going to be there each and every time you go to use it for every subsequent visit. You're going to be assigned a username and a password, and that's how you would access your virtual medicine profile. Okay? Now, in addition to things like cold and flu and rashes and pink eye and headaches, you can schedule virtual behavioral health appointments, and we do have the ability to provide you with a dermatology network as well. So if you got a rash or something, you got that camera on your phone or tablet, you can show the doctor what's going on with you. So again, it's the copay for something like a cold, flu, or a headache, something that you would interface with a general doctor for, it's going to be $5 less than your primary care physician copay. If you're going to see a dermatologist, I believe the copay is going to be the same as your specialist. And if you're using behavioral health, it would be the same copay as if you were using behavioral health in a live setting of an LCSW or a psychologist. Okay. So you create an account, you select your doctor. We have Amwell and Doctors on Demand that we partner with, and then we have the dermatology network as well. So there's 3 different networks, and you can find a doctor. We give a list of providers that's on the site, just like our provider directory online that we have. It'll give you information about each doctor that's in the network, and then what you do is you choose a doctor and click Start Your Visit. Now, what may happen is a screener may reach out to you to talk to you a little further about your condition to make sure that it's an appropriate condition for virtual medicine. And if the screener feels that it is appropriate, then they'll either push you to that doctor if that doctor is available right then and there, or they'll say the doctor will be ready in 2 hours and he'll call you. And then once you're pushed to that doctor or that doctor calls you, then you're working with that doctor real time to solve your medical condition. And then if you need a prescription at the end of the thing, you give the doctor your pharmacy, and they'll go ahead and call in that prescription. Very convenient. So yeah, we just went into that. Sorry. Ready?
Can Okay, this is
Oh,
me.
wait a minute, Frank,
Oh,
I'm sorry.
yeah, there was one other thing.
Yes.
Go ahead.
So, we talked about urgent care, we've talked about virtual medicine, okay? And what we wanna do, and we really haven't had a chance to get in front of you guys in the past, so I really wanna take this opportunity to kind of talk about our website and all of the things that are available to you on our website, because, what you would need to do is set yourself up as a user. So again, like setting up your profile for virtual medicine, you're gonna set up your profile online. And once you're registered, you're gonna be able to look at real-time claims. So you're gonna see where you are in your deductible, you're gonna see the availability to print out explanation of benefits. So if you lose an EOB and you get a bill from a doctor and you're not sure if you owe it, you can go out on our website, look at your claims, print off EOBs as needed, or look at them if you don't need to print one off. It'll tell you where you are in your deductible. A nice thing that is also an enhancement to our website is our cost of care estimator. So if you do choose the $2,500 deductible plan, and say later in the year you hurt your rotator cuff and you're going to need rotator cuff repair, you can go out on our website, plug in your zip code, plug in the type of procedure you're looking for, using a rotator cuff as an example. It'll be in a drop-down list of all of the different procedures that we cover. Click on rotator cuff repair, put in a radius of 20 miles from your zip code. It's going to give you a list of all the providers in our network that do rotator cuff repair. It's going to give you an estimated cost for that procedure. I've seen the variance from one provider to another as great as $100, okay? So healthcare is one of those things where you really don't know what you're on the hook for until after you have the service. Now what we're giving you are the tools and the resources to kind of know what's going to be your responsibility before you have the service. Shop by price, can also shop by frequency. So if I'm worried about my rotator cuff and wanting full range of motion, I'm not going to be so concerned about saving maybe $100 over one provider to another. I want to go with a doctor that's doing it 4 times a week as opposed to the one that's doing it 2 times a month. We'll be able to give you that information as well. So we give you a lot of tools and resources out on our website to manage your healthcare and your costs and get you the best outcomes. We also have wellness tools on our website. So we have things like a personal health record. That what it does is it pulls in your claims, okay? In addition to that, or in tandem with that, is a what is it called? A health risk assessment that you can take. And it's about 80 questions, and it probably takes about 20 minutes. And if you know your vitals, like your blood pressure levels and your cholesterol levels, you can plug that all in. And what it's going to do is it's going to take what you filled out on your health risk assessment, it's going to pull your claims into it, and it's going to stratify your risks. And it's going to give you suggestions on what you can do to minimize your risks. So for instance, if you've got cholesterol at 236, it's going to tell you, all right, look, you may not need prescription to control your cholesterol, but here's some things that you could do maybe to lower it. You do this exercise routine, or eat oatmeal or Cheerios, something like that. It's going to work with you to minimize your risks, okay, and get you healthier. All right. A couple other things that we have available to you is a vision discount program from Davis Vision. So if you need glasses, you can take your prescription to Pearl Vision, JCPenney's, Sears Optical, Halpern Eye, and Vision Works. Give them your ID card, and they're going to take a discount off the cost of the glasses. You pick out your frames, what options you want done to your lenses, and they'll give you a discount. There's no paperwork that you need to fill out. The only thing I would suggest is call ahead of time before you go, because not every location participates. For example, Sears Optical up in Concord Mall is in the network, but the one down at Dover Mall is not.
What about an examination?
Okay,
That's
so
not covered.
routine eye exams are covered once every 24 months under your medical, but the discount program will give you a rudimentary exam at the optician on that off year if you wanted to, and I believe it's what, is it a $5
I
copay?
think it's 10.
$10 copay. It's not gonna be as involved as the one that you would get with your ophthalmologist or
Yeah,
optometrist.
then we'll do the drops and all that.
Yeah.
It's just but it's cool though, every other year to do it, and then they get the good one every 2 years.
Right.
But, I mean, I just feel like, you know, with Highmark, we have a lot of resources that are out there to help you, and we just haven't really had the opportunity to get in front of you and really tell you about it. I'm excited about it, and, you know, we just wanted to take the time today to talk to you about all of those things that we have available for you to use.
The key here, guys, is to get on the site.
Yeah.
Get on the site, sign in, I mean, it's proprietary to just you, okay, so get on the site, give me information, fill out your wellness profile. I have Blue Cross also, and that works like a charm, it's really cool.
It's a good website.
Yeah, it's a neat site, once you get into it, I know we're all busy, we all got time to do it, if you do need that surgery, and you need a knee replacement or something, it's gonna help you make a decision. It's neat,
One of the other things.
and isn't it directive to their plan, Drew?
It
Yes.
is.
The plan that you've entered into, if you put the 2,500, it's gonna work that deductible into your choice of doctor to choose, and it's gonna tell you how much it's gonna cost you.
And how do you know who I see that none of you do know out of network, you pay for nothing out of network.
Yeah, because there's hardly anybody out there.
It's like a nationwide network.
Yeah, it's a national
It
network.
is,
Yes.
it's
Any
not
Blue
just,
Cross and
it's
Blue
not
Shield
just
care.
No,
Delaware.
it's not just Delaware, it's
No,
Okay.
why?
Now, there's a couple things that we will cover out of network. Emergency care, so if you're stuck somewhere out in the middle of nowhere, like Wyoming.
Right, or you're on vacation in another
Right.
area and you have to go, you're gonna cover that.
Yeah,
Even
you're
though
in
it's
some-
not a network doctor. or
Podunk
something.
Hospital,
Right,
it's not in the network, we'll
Okay.
cover the emergency care. And then a lot of the times when you go for surgery, you don't pick your anesthesiologist. So, some anesthesiologists are not in the network, we're not gonna penalize you for that, we're paying their services.
Right.
Okay.
Because you don't know, you're
Right,
you're kind of
you know.
But where do you find this network? Is it, I mean, you have it
It's
on
on
your
our
website?
It's on our website.
Okay.
Yep.
Yeah, that little postcard will tell you how you can look up doctors in the network.
Look up the doctor,
And
anything
you
you
don't,
have there.
well, I mean, we want you to enroll in the website, but you don't have to look up doctors, you can just do it right on the
Right.
regular website.
But you really wanna get on that network.
Yes.
One other thing in your kit, I'm sorry, and I'll shut up after this, is My Care Navigator, which is like it's like a second layer of customer service. So our customer service department is available to help you with claims and benefit questions, okay? But we now also offer like a concierge service where we'll work with you to tell you information about doctors in our network. Okay, we can talk to you about, just like the cost of care estimator, our customer service folks have the same access to that system, so if you're ever without access to your phone or your tablet or your computer, you can reach out to our customer service department, they can give you that information, they can tell you how frequently a doctor does a procedure, they can tell you where they went to med school,
And they can make
Okay.
appointments.
they can make appointments for you. So, you know, you just give the customer service a couple dates and times that work conveniently for your schedule. A lot of the times when you're making an appointment with a specialist, or if it's flu season, you're either getting a busy signal or you're waiting in a queue to talk to a scheduling assistant, and you're missing time from work. So they'll be able to make an appointment for you, and they'll call you back to let you know that the appointment's confirmed. Another nice thing is that when you're going to see a doctor for the first time, they're not gonna have your medical records more often than not.
Right.
We have the ability to work with your other doctors that are treating you and sending those medical records to your doctor. The reason why we do this is because studies have shown that when you go to see a doctor, you might get up to 8 minutes of FaceTime with the doctor, okay? And when you're seeing a specialist, it's costing about $350 for that specialist visit. So if you're only gonna get up to 8 minutes, and when you walk in the door, brand new, for the first time, and the doctor doesn't know you, and you don't know the doctor, okay, they're gonna ask you, what are you here for, what am I seeing you for, what are, you know, what are some of the conditions, symptoms, whatever, okay? If we can get your medical records to that doctor on the front end, we can give you information over the phone about that doctor so that you feel confident that you're going to a good doctor. When you hit the door and see that doctor, you're not wasting time telling that doctor what's going on with you. They've already got your medical records, and if they're worth their salt, they're already looking at your records before you walk in, so that you're maximizing all of that value out of those 8 minutes. And that $350 that we pay is money well spent, because they're treating you as soon as you walk in the door, not getting to know you. So, a lot of great resources that we have available to help
Please, join the website, it's simple, just.
Okay, the last thing we want to just mention is this, funds spending account. We all know what the FSA is. Okay, it's a special account, you can read it there, that helps pay for healthcare expenses for yourself and your family members. Okay, such of the things that are covered underneath there, like deductibles, co-pays, over-the-counter drugs, dental deductibles, eyeglasses, smoking cessation. There's a whole laundry list of stuff that's covered by the FSA. And if you see there, we currently use a company called Beneflex that is now called Clarity Benefit Solutions. You go on that site, www.claritybenefitsolutions.com, it tells you everything. Anything that you wanna look at that an FSA can be used for. Okay, you can probably get a little bit more information if you're interested in the FSA or contributing to the FSA through the HR. They've got all that stuff. Okay? Now, the next slide says, I think, question.
Ugly face.
Yeah, cute lady.